We are from Group HG1. We are going to present about our developed product that called as Patient Triage and Monitoring Kiosk. Our group is supervised by Professor Madhya IR Drive Audrey Hong Kar Ching. This is our team members. MAHAD Ali WARSAME, Muhammad ANIQ Wazilo bin Danilo, Muhammad HAZIM bin SHARIF, NURDINA AISYAH BINTI ROSIDI and NURUL Farah WAHIDA BINTI Norman.
Hi, I am NURDINA binti ROSIDI. So the first one is what we are going to empathize. During the empathize stage, we focus on understanding challenge faced by patient and healthcare staff during triage process. Usually, patients experience long waiting times and delayed health assessment, which can cause discomfort and anxiety, especially for urgent cases. Healthcare staff also face difficulties managing high patient volume and performing manual triage, which it will make more time consuming. So, from this problem, we identify three user needs, which is fast health assessment, efficient patient prioritization, and reduced waiting time. Now, we move on to the define. So based on the previous slide, which is the user needs, we define the problem is the delay in patient assessment and prioritization due to manual triage procedure. High patient volume can reduce efficiency and increasing waiting times. Therefore, our objective in this project, which is to develop a patient triage and monitoring kiosk that is automatically measure vital signs and categorize patient urgency levels. This improve assessment speeds and support healthcare staff in making decision.
Hi, Assalamualaikum. My name is Muhammad SHARIF. So for ideate, we generate several ideas during the ideation stage, including improving the manual triage system, developing a mobile health monitoring application, and creating a smart kiosk for automatic patient screening. After evaluation, we selected the patient triage and monitoring kiosk as our final concept. This is because it provides a fully automated and faster solution compared to manual methods. It also combines both patient monitoring and prioritization in one system. In addition, the system is affordable, practical, and easy to implement in hospital or clinics, making it more suitable. Alright, for NADC, this project focuses on improving the current patient triage process in hospitals. Nowadays, hospitals often face overcrowding, which lead to long waiting time. The triage process is still done manually, so it can be slow and sometimes inconsistent. Because of this, critical patients may not be identified early. To solve this problem, we propose a patient triage and monitoring kiosk. The system uses sensors such as a measure heart rate and blood oxygen level, and one more measure body temperature. So ESP32 is used for the process the data and send it through IoT, while a simple AI system classifies the patient condition into different priority levels. The benefit of this system is that it can be speed up patient assessment, reduce waiting time, and ensure critical patients receive attention earlier. It also help reduce the workload of healthcare staff and allow monitoring. In terms of competition, most hospitals still use manual triage or basic monitoring device, while advanced systems are expensive. Compared to this, our system is more affordable, automated, and combine both patient monitoring and prioritization in one solution. That's all. So the total estimated cost of all component is 107.4 ringgit Malaysia, which show that the system is affordable and suitable for practical implementation.
Assalamualaikum and hi, my name is NURUL Farah binti Norman. My maintain number is E230005. I will present about the step analysis integration. First, social, minimize cross-infection via contactless temperature sensing and speed up check-ins using quick scan RFID cards for patient profile looks up. Next, technology bypasses human errors via digital sensor, pushes mobile notification via the Blink IoT platform and archive logs into a central Google Sheet. Next, economic, maximize clinical labor efficiency by automating triage and registration, freeing up staff for high urgency cases. Next, environmental, cuts paper waste entirely by moving intake form to a fully digital cloud database utilizing the ESP32's low power modes. And lastly, political, assure rigid healthcare policy compliance through preset threshold rules and protects local administrative patient logs.
Assalamualaikum warahmatullahi wabarakatuh. My name is MAHAD Ali. Today I'm going to present the prototype concept. The proposed prototype is a patient track monitoring kiosk designed to reduce long waiting times. The system uses ESP32 as the main control because it supports sensor processing and IoT-based development. The prototype allows a patient to register using RFID card, and then the system automatically measures the basic vital signs such as heart rate, SpO2 means oxygen level, and the body temperature. The readings are displayed on 16 times for LCD, which is a liquid crystal display. For quick viewing, we got the MAX 30102 sensor. It's used to measure heart rate and also oxygen level, while the MLX 90614 sensor is used to measure non-contact body temperature. After collecting the reading, the ESP processes the data and checks whether the patient condition is normal or critical. If the reading is critical, the buzzer will beep, alert health staff. The prototype supports factor patient assessment, efficiency, patient prioritization, and early detection of critical patient. For the next part is logic flow. First of all, the first start is the starting system. ASP will power on LCD RFID module MX and 30102 MLX, and also the buzzer will be initialized. The second will be patient registration. The patient scan RFID sensor. ASP reads the patient's ID, and also the third one is vital sign measurement. The max measures heart rate and oxygen level. MLX measures ambient temperature, which is the surrounding temperature, and the body temperature. Also, the first one is data processing. The ESP32 process all sensors reading. The system compares the reading with a present critical. The display output. The LCD display reading the basic condition classification. If the reading are normal, the patient is categorized as a normal priority. If heart rate or oxygen level or body temperature is abnormal, and then the patient will be categorized as a critical alert system. If the condition is critical, the buzzer turns on, otherwise the buzzer will be off. The continuous monitoring for the system continues updating the reading. Healthcare staff can use the result to prioritize patients faster. As you can see in my right hand, or maybe on the left as a reader, you can see the flow chart in here, starting power on ESP, initialize LCD RFID, max MLX, and the buzzer. Then the display. So, and then after the patient account, it has to scan the RFID card, and then RFID module reads the RFID card if the patient's registered or not, and then that's on all the reading until the continuous monitoring. Thank you so much.
Hello everyone, my name is Muhammad ANIQ bin DANILO, and today I am demonstrating about our project, which is patient triage and kiosk monitoring. So let me tell about you guys why we do this project. So in traditional hospital, checking into the emergency room is very slow. So patient have to queue up to register with a nurse, wait to get their vital measure manually, and then wait again to assign a priority level of them. So during the peak hour, this long line can cause dangerous delay for critical ill patient. So my project solved this by introducing an automatic self-service triage kiosk. So by combining RFID scanning and with smart biomedical sensor and cloud connectivity, patient can check themselves in. So instantly measure and their vital and let the system categorize them automatically. So this eliminates waiting line, save time, and help doctor identify critical emergency immediately. So about our hardware component and interwiring, so let's open up this enclosed box and look at the hardware. So the brand of this system is ESP32 deployment board. So we choose it for the fast processing speed and is built in Wi-Fi module, which lets us stream data to multiple cloud platform at the same time. So connected to the ESP32, we have our key component. As you can see, we have the buzzer, we have the RFID module, and we have the pulse oximeter sensor, we have infrared thermometer at the front, and the last one is the user interface, the I2C LCD screen. So here are a quick look at the firmware writing in the Arduino IDE. At the top, we configure our Wi-Fi credential, Blink authentication token, and our unique Google App script web app URL. So the script collect the sensor input, bundle them into an HTTP request, and transmit them securely to our cloud platform. So let's go to the live functional demo. So let's see how it works in real life. When a patient walk up to the kiosk, the screen read hospital check-in, please scan card, and waiting in the screen. So what should happen when a patient scan their registration card? So the RFID reader instantly scan the card, register the patient identity, and prompt them to place the finger on the sensor bed. Within a second, the ESP32 calculate the vital sign. If the vital detect a dangerous state such as a critical fever or low oxygen level, the buzzer immediately sound a loud warning alert, and the LCD screen switch to a flat a warning or critical state, letting the patient know they are being prioritized. So let's watch how it works. So let's look about our Google Sheet and Blink monitoring. So at the exact same time, the data is pushed directly to the cloud. Let's look at our Google Sheet at the left side. So our database run an automated script that calculate the triage level based on the incoming number. For example, when Danish Hakim register with a high fever of over 40 Celsius, the system instantly mark his status as a critical, turning his raw bright red. So if a patient have minor system, it turn yellow for warning, and healthy patients stay green for normal. So finally, the data show up instantly on our Blink IoT dashboard and on the right side. So emergency room nurse and doctor can monitor the live gauge for heart rate, SpO2, and temperature from anywhere in the hospital. We also added a silent alarm switch. Once a nurse see a critical flag and goes to help, they can toggle the switch remotely to silence the buzzer at the lobby kiosk. So in conclusion, the project shorten waiting line, automated registration, and ensure critical patient get immediate medical care. That's all from our group. Thank you for watching.